Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making, and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/childwelfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. On this week's podcast, Mentoring Month continues here. Last week we had Terry Sorensen, who's head of Friends of the Children, on to talk about her organization's business model, which really focuses on kind of professional friends or mentors in the lives of kids. This week we have Jeff Fleischer, recently retired CEO of Youth Advocate Programs, the nation's largest alternative to incarceration program, whose model is also built around professional mentoring adults hired from the communities they serve to engage and support individual young people. So we're going to talk to Jeff about his career, his own mentors in the work, how the juvenile justice business works in general, and about his new venture called Neighborhood Safety Advocates. We went fairly long in that conversation, so I'm going to keep the headlines pretty brief today. I wanted to talk about a few similarly situated and themed pieces of research that I've come across of late, and then commend a few recent Imprint articles to everybody. All right, so on the research front, I will post links to where you can find at least synopses of these three that I'm about to tick off to you in the show notes, but these are all related to the issue of drug testing of parents and newborns in the hospital and how it relates to child welfare. So report one examined records from almost 60,000 deliveries at 5 Massachusetts hospitals between 2016 and 2020 to see patterns in toxicology testing. They identified just under 2,000 tests done on mom and baby pairs, and just over a third of those involved a parent with a substance use disorder. So of the 2,000 or so tests, about a third were done on a parent essentially with a known or documented substance use disorder. The study focused on that other larger group of tests that were done on patients without a diagnosed problem. And the findings were that those tests, the ones done on parents without a diagnosed issue, were disproportionately performed, and I'm quoting here, on non-white, younger, and publicly insured mothers and their infants, and that cannabis use and medical complications prompted testing more often for patients of color than for white, non-Hispanic individuals. Okay, so that is report one. Okay, now report two looked at 26,000 births at one Midwestern medical center between 2014 and 2020, guessing from the report authors and from some circumstances that become evident in the study that it's Michigan, but I guess it doesn't really matter. So 26,000 births at one Midwestern medical center between 2014 and 20 to see the differences in drug testing rates of newborns by race and ethnicity of parents. And this study found a few things. First, that newborn drug testing was ordered for Black patients way more often than white. It was 7.3% versus 1.9% of times. Second, nearly half of the tests, 43% of the tests that were positive only for THC or for marijuana exposure. When it came to opioids, white newborns were more than twice as likely to show positive. And then third, the state, which again I think is Michigan, I live here and I think this tracks with it, the state legalized marijuana amidst this study range, and the rate of disparity in testing did not change while positive tests for THC increased. And so to quote the authors in their conclusion, our study adds to evidence suggesting that structural and institutional racism contribute to over-testing Black newborns and possible subsequent over-reporting to CPS. So as that kind of comment relates, both of these two studies are recent and specifically call out as a motivating interest in the research the tie between these kinds of tests of moms and babies for drugs, toxicology tests, and requirements in federal law via an update to the Child Abuse Prevention and Treatment Act in 2016, whereby these hospitals are required to mandatorily report on positive toxicology tests to the child welfare system and require hospital providers to address the health and substance abuse disorder treatment needs of the infant, an affected family or caregiver by notifying CPS, while also helping to develop plans of safe care for each identified infant. So then I want to bring in another recent study that looked at a system, in this case it is Connecticut, that is known in the study, that created a process by which many positive drug tests are actually diverted from a direct report to CPS on the parents. In those cases, basically what happens in Connecticut is that a de-identified notification is sent to the system and a plan of safe care is developed, in many instances by the hospital, using a rubric that they put together with the Child Welfare Agency in Connecticut. So this is not to say that nobody in Connecticut has ever reported for infant substance abuse exposure for an open case. That does happen quite often, but the process takes that mandatory nature out of it, as certainly as far as personally identifying a parent to DCF goes. So this study, which was done in the fall of 2022 or published in the fall of 2022, looked at the 5,526 notifications of positive toxicology tests that were made between March of 2019 and July of 2021. So pretty recent sample. Right off the bat, there were 763 notifications where there was too much missing information, so that knocked it down a little bit. So the total number they were able to examine, of that, about half of those notifications, 2,453, were diverted in this process. So a de-identified report was sent to CPS. The parent was not reported on. The hospital came up with a plan of safe care with the parent. So what the discussion section of the report and the study authors discuss in their findings lifts up is that while the updates to the Child Abuse Prevention and Treatment Act, or CAPTA, that we just talked about a little bit ago, came into effect around the time where we were frantically as a country trying to address a burgeoning opioid crisis that really continues to this day, marijuana use is what has been identified through the new requirements the most. In Connecticut, per this report, 4 marijuana exposures for every 1 opioid exposure. And then on the other side, they found that pretty much evidence that clearly suggested to study authors that there is under-identification in this process of alcohol exposure. So almost no identification of alcohol exposure in these, several thousand notifications. It was 0.2%, which authors note is 47 times lower than the national average rate of self-reported alcohol use in pregnancy. So in other words, when you just anonymously survey parents, the reported use is of alcohol is much, much, much higher than what these tests and notifications would suggest in Connecticut. They also found that Black mothers were disproportionately overrepresented among the notifications and that Hispanic mothers and white ones were underreported. But then they included several key passages around that issue that I wanted to read because I think they're pretty important. So I'm going to read them all. They're all pretty close to each other in the discussion section of the study. Quote, assessing proportionality using population parameters as the denominator is in some ways misleading because hospitalists typically determine which infants are tested. Notifications measure infants who are tested and who test positive. So in other ways, they're basically saying it's a little misleading to track disproportionality based on comparing the notifications to population level things, because it takes a critical element out of this, which is that these doctors and people at the hospital have a lot of say in deciding who is going to get tested and who might potentially have a notification. So continuing on that thread, here's another passage. CAPTA requires a series of informal hospitalist assessments, whether to verbally screen, order toxicology, interpret toxicology as an indication of substance misuse, and infer substance abuse and other factors as indication of child maltreatment risk. This leaves physicians to rely on their own opinions, training, or hospital policies. Most birthing hospitals, including those in Connecticut, selectively screen for substance abuse exposure, resulting in likely underdetection, particularly for older, more resourced white women. So really, same thing. This is basically just expounding more on the very arbitrary nature that is at the root of sort of the expectations that professionals at hospitals are going to make their decisions based to some extent on their own subjective opinion. So in closing here, and this is where I think there would be some divergence, I think, among people who feel that this is a serious issue and probably leads to a lot of racial and ethnic disparity. Here is what the study authors put forth as a solution to addressing that subjectivity. And I'm quoting here: addressing the problems of racial disproportionality and inconsistent use of plans of safe care begins with universal screening for substance abuse, including alcohol and mental health disorders. The American Academy of Pediatrics recommends universal substance abuse screening in pregnancy. So it's just to draw two things away from the combination of these things. One is that last part that I kind of called out from the Connecticut study, and that's the issue that it is essentially a truism that if we screened every pregnancy and every birthing parent and child for substance abuse exposure, for alcohol as well, that would take the potential for discrimination based on race and ethnicity, poverty and class, public insurance or otherwise. It would take all that off the table, because if you're screening everybody, you're screening everybody. At what cost, I think, is where you would get some disagreement, because that is quite a large surveillance sweep of parents to do. And that ties into the other aspect of this, which is that premise of universal screening really runs up against the concept of mandatory reporting on all these and leaving any discretion out of the hands of hospitalists and professionals at hospitals to make their own decisions about what the situation is, which Connecticut seems to be trying to address by putting the decision in their hands to divert a case away from, formal proper notification of a person's name and sort of de-identifying it to divert them to just the plan of safe care. And then the other thing, which was spoken to in all three of these studies, is just the extent to which, it is the case that the new requirements in CAPTA rose up around the time where we were, really scrambling to figure out how to better support parents who were dealing with opioid addictions. And the byproduct of these policies, at least the majority of toxicology testing in general, is popping up THC use. And my humble opinion, I think we're probably within 10 years of marijuana being legal everywhere. Obviously, it is legal recreationally in a large number of states now. And we also have some indications from research that marijuana use during pregnancy can have negative effects on children, which all sort of culminates to some extent in that, is there negative health effects to be experienced by a child from a parent using marijuana while they're pregnant, or opioids while a parent is pregnant? Yes to both. I mean, it's certainly possible for there to be negative health effects. I think I'm on safe ground to say that the ongoing child safety concern is higher when it is understood that a parent is continuing to use opioids, as opposed to ongoing use of marijuana after a child is born. Not to say that there's no risk, but I do think that, we have legalized marijuana in many, many states around this country. We have not done so with opioids, illegal opioids at least. So I guess, at some level, what these studies really speak to is that there's a very, compelling reasons to test for substance exposure in children and to parents to some extent. But any value of that in terms of counseling a parent or helping a child is made problematic to some extent by the broader context where the expectation is that all of these positive notifications must be reported to a child welfare agency for consideration, at least, of investigation. And it'll be interesting to see over time how the Connecticut experiment goes and what they see. Hopefully somebody does kind of follow up studies on the notifications and what happened, in these cases afterwards. All right, I said quick. We're already at the 15-minute mark before we get to an hour-long interview. So 3 quick recommendations from the imprint. Again, I'm going to link to all of these for you if you want to read them. First up, there has been some spectacular journalism of late. We've discussed it here on the podcast before about the practice of child welfare systems becoming the payee on Social Security benefits that are owed to children in foster care. So our Jeremy Loudenbeck reported on what has happened in the policy and legislative world since the groundbreaking reporting done on this by Marshall Project, NPR, and others. And he found at least 11 states and 4 cities that have introduced proposals to better ensure foster youth and their relatives and their families are better notified of their ability to retain and save up those Social Security benefits. It's a mix of policies and laws with some real teeth, some that are more modest, and it really continues to be an evolving landscape that Jeremy captured very well in this story. Also, from Mr. Loudenbeck, we have talked a few times on here about the dreadful state of juvenile facilities in Los Angeles County, one of the largest local juvenile justice systems in the country, and he reported last week on just how much everything is coming to a head in Los Angeles at the same time. So you have these facilities that nobody really wants to use. They are what they have. They're really kind of out of compliance with safety standards still. You have a slower than promised move towards youth development and community support in the system that was promised several years ago during the pandemic. And then you have the looming summer deadline after which any Los Angeles youth or young adult who is currently housed in California state juvenile facilities is going to be sent back to the county to handle as the state winds itself entirely out of the juvenile incarceration business for good. So read up on that. And then finally, from Nancy Marie Spears, who you heard take over my podcast for a couple of weeks last month, a Northern California tribe and one of its members who was in foster care has sued Humboldt County, California, and the California Department of Social Services, alleging that the county cut her off from extended foster care because she received a trust fund distribution from the tribe when she turned 18. So in other words, the county was asserting that she made too much money in the year she was trying to get into extended foster care to be eligible for, extended care housing. And then they booted her out of it after originally permitting her into the program. So she had already moved in, got the rug kind of pulled out from under her, and created all kinds of instability in her life. So you should absolutely read this article. It's really interesting. And I think it touches on a bigger question of how, if at all, foster youth should ever be deprived of foster care related benefits because they inherited some money or they got tuition assistance or received guaranteed income, right? That's something that's happening more and more around the country. Or in this case, got a trust fund distribution from a tribe. I think if you just kind of asked 100 people on the street, should any of those things be held against a foster youth and trying to continue or maintain the benefits they were owed, essentially as being foster youth, you might get 100% of people saying no. Anyway, go read all 3 of those. And when we come back, my interview with Jeff Fleischer.
For 2 decades, Fostering Families Today magazine has educated families raising and supporting children and youth in foster care. Delivered in print or online 6 times each year, Fostering Families Today gives families the latest tips, strategies, and research on caring for children with traumatic backgrounds. Use promo code PODCAST5 to save $5 on a print or digital subscription today. Just go to fosteringfamilies today.com/subscribe and enter PODCAST5 to save $5 on your subscription. That's fosteringfamilies today.com/subscribe.
We are joined today for an exit interview of sorts with the one and only Jeff Fleischer, who after 38 years with Youth Advocate Programs, which is better known as YAP, is sailing off into retirement. And I mean that literally. He owns a sailboat and we will probably never see him again. Right, Jeff? Welcome to the Imprint Weekly Podcast.
John, thanks so much for inviting me. I love being here. Yeah, I'm not going anywhere. I'm still going to be in the field. I will do some sailing, but hopefully we can talk about future plans as well. I'm honored to be here, John. I always thought that when I met you, I don't know, some 30 years ago almost, I still think you're the most knowledgeable journalist and professional in the field of child welfare and youth justice. So it's just an honor for me to be here with you.
I appreciate that, man. Thank you very much. What is the sailboat called, and where will you be sailing on your first summer as a retiree?
I picked up an old sailboat. It's called the Puffin.
The Puffin. I love that.
This boat was built in England. It was built for the North Sea. It was really rugged. And I got it in New Bedford, Massachusetts on Buzzards Bay, and took 12 days to sail it down with some buddies to the Machiticon River here in New Jersey.
Very cool. Let's start, I think, before we get into your career and your thoughts on everything, and tell folks who may not know much about YAP about the very interesting history of this organization. So let me try to flesh it out a little bit, and then you fill in the many blanks that I leave. Kind of starts before the inception of the organization with a guy named Jerry Miller, who was tapped to lead the basically Massachusetts juvenile justice system way back in the day in the 70s, and a guy who was kind of his right hand named Tom Jeffers. There's a great book about this. I'm not going to belabor this part of the history, but if you want to go try and track down a copy of Last One Over the Wall, it tells the story of how basically they decided best thing we could do is probably abruptly close these pretty abusive youth facilities and prisons that Massachusetts was using, put all these kids back in the community, and then work like gangbusters to try and serve them there. So Jerry moves on from that to kind of gallivant around the country a little bit, but the Midwest and the East Coast, I guess, really trying to do that both in juvenile justice and child welfare. Really just, became the kind of iconic de-incarcerationists of youth in the country. And Tom leaves to essentially take the other part of it. So he's shutting down facilities. Tom starts YAP basically to try, maybe I'm overstating this, their idea at the time, but to create the solution for what to do instead. Is that about right? I mean, he basically just came up with, instead of incarceration, what can we do with a youth who's done something serious?
Absolutely, John. You really got the history. And I can't even talk about my career without mentioning fully the careers of Jerry Miller, Paul DeMuro, Tom Jeffers, Bill Ryan, Dick Salmons, John McKnight. These are the guys that in the 60s were really actively shutting down cages, shutting down youth prisons, and replacing them with community-based alternatives that really worked. And you're right, John, laws came out that prohibited youth from being placed in adult prisons. And the infamous Camp Hale prison in Pennsylvania was filled with 400 young people right next to the adult prisoners. Laws changed. They had to get those kids out of there. And Jerry asked Tom to form his own organization, a community-based organization, on what to do with these kids when they got home. So he developed the beginnings of the Youth Advocate Program model, which is basically a paid mentorship model that really tries to address all the needs of young people coming back to community after being traumatized and incarcerated and re-traumatized, and really connecting with families and work and school and church and activities and peers. So those are the beginnings back in 1975 when YAP was founded by Tom.
So you joined up 1984, right? Is that about right?
1985.
1985.
9 years.
Okay.
Yeah, that was almost 9 years that YAP had been in existence. And Paul DeMuro, I was working in Newark for La Casa de Don Pedro, which is a community-based organization.
And still going. I looked it up because I was like kind of brushing up on your history before we did an interview, and I noticed that was like your first job before this. And I was like, I bet that place is just gone. And then I looked it up. I was like, oh, everything Jeff touches stays around.
Well, I don't know about that, but Ramon Rivera was the founder. He was a young lord in New York City in the 60s, and he came to open a Young Lords chapter in Newark in 1970. Wound up taking over a church, and the minister, a pastor from Georgia, actually says, what would you do with the church if I gave it to you? It was an old rundown place, and he created and founded a multi-service center, and part of that was a youth program. And I ran their Youth and Community Development Center. It was a burned-out warehouse. Ramon got it for $1, and then he gave me keys. He said, build a youth center. So we got a grant from the Department of Labor. We hired 30 kids full-time at minimum wage. We hired unemployed carpenters and plumbers and electricians from the community. And they designed and built their own youth center that still stands today at 23 Broadway in Newark. So I did about 4 years there, cutting my teeth in with the Columbus Homes NBC News called it back the most dangerous neighborhood in America at that time. And it wasn't, I mean, it was a high crime rate, but the kids were just wonderful. And it was a great, great experience. Paul DeMuro was one who worked with Jerry and Tom, was one of the funders. And I had a great relationship with Paul. And I was ready to leave La Casa. And Paul says to me, you need to meet somebody. And he introduced me to Tom Jeffers. At that time, was looking for a director in Newark, New Jersey for the Youth Advocate Program. And I said, sure, I'm about done with my assignment here at La Casa. I'll come aboard for 1 year and help you sort of, get it straightened out and started again. And that was 38 years ago. So stay with Yap all that time.
What was his pitch? I mean, what sold you? How did Tom Jeffers sell you on what would end up being your entire career?
Oh, man. I had never met anyone with a vision like Tom and a down-to-earth way of telling the story. And he told the story of the Massachusetts experiment and shutting down the institutions and how they did it together as a group of people who said, we're doing too much harm here with this government system. We've got to shut it down and replace it with something that works. And it was the first time where I heard about redirection of resources, shutting down very expensive cages built for kids or built for adults, but used for kids, shutting them down and taking that money and then redirecting it to community-based programming. So that concept of redirection really resonated with me because I was walking the streets of the Columbus homes in North Newark and working with gangs, and kids were getting locked up and beaten by police left and right and placed in institutions, and they would come back worse, traumatized, and they just continue with nothing to break the cycle. So that really resonated with me. And also we were nickeled and dimed to death at La Casa. We were given tiny little grants to do major work with kids with the most complex needs and the most trauma and the most desperate poverty. And there was hardly any money for resources. So I said, wow, but you're spending hundreds of thousands and millions on jails and cages. Yes, that money can be redirected. So Tom's message there, I just walked right on board with Tom after that and never looked back with any regrets.
Was he able to demonstrate at the time that he had successfully done that, or was that a vision at this point? I mean, he had the first 9 years of YAP shown, like, I can convince these guys to turn off the incarceration tap and put it towards us, or what?
Yes, in places. At that time, they were only in a few counties in New Jersey and a few counties in Pennsylvania.
Right.
Their largest program at that time was an alternative detention program in Philadelphia. So where they existed, they were proven successful, but they were having a hard time at that time growing. Tom's vision was really to get as many communities to adopt alternatives to incarceration and out-of-home placements as possible. So at that time, that was yet to be proven, that you can replicate this program in many places around the country or around the world even.
Yeah. The big sea change, right, is when you guys land Texas in 1992. So you've been on there for a while, but that was major, right? That took you off the Eastern Seaboard and you're in somewhere different.
Right. Tom would always say that was, for him, the turning point. Again, Paul DeMuro is the one that referred us to Carrie Cockrell, who at that time was the chief of probation in Fort Worth, Texas. The Bloods, the Crips, and the Latin Kings were literally killing each other every week. There was 2 or 3 shootings and 2 or 3 fatalities. And Carrie brought us in to Fort Worth, and we started a program there, working specifically with the Bloods and the Crips and the Latin Kings. And we really upped our method of recruiting people with lived experience from the community. These were people from Fort Worth, grew up there, were in gangs themselves primarily, or had relatives, and they were all from the community where the kids lived. The first neighborhood was the Poly Stop 6 community of Fort Worth. That was the highest crime rate. Most of the kids that were shipped to youth prison in Texas came from that neighborhood. And after the first year of running YAP, recruiting people from the community who knew what they were doing and had heart and guts, Carrie was able to reduce his commitments to the Texas Youth Commission, their prisons, state prisons, by 44% after 1 year for the entire county, even though we're just focusing on this one high crime neighborhood, the Poly Stop 6 community. So it was important in many ways. It was the first time we're able to administer a program far from our headquarters in Harrisburg, Pennsylvania, but also demonstrate that you can take this model, adapt it to another local community with very specific needs, and make it work.
We had Gary Ivory, who I think ran Fort Worth, right? That was kind of his first gig with you, was kind of leading the work there. On the podcast, I think 2 years ago, he told us a crazy story about how he got buy-in, or you guys all got buy-in from some of the critical gang leaders at the time by doing that tour of the South. Do you remember that? Were you there for some of it?
Yeah, Gary and his team were the ones that pulled it off. But I tell the story, and it just was incredible. With the Bloods and the Crips, what they found was that they were both African American gangs, primarily made of African American kids, and they really didn't know their own history. They didn't know about the civil rights movement. They knew very little about Dr. King. They knew nothing about the Birmingham bombing in Alabama, the church and that killed the 3 girls. They knew nothing about Selma and all the organizing all over the country during the 60s. So they said, let's take these kids in vans from Texas through the South, through Alabama and Georgia, and let's show them, let's stop at all the civil rights monuments and museums and landmarks along the way. And the Bloods and the Crips in one set of vans, the Bloods in one set, the Crips in another. And then as they got to know each other, they started sharing the same vans, Bloods and Crips in one van, Bloods and Crips in another van. And when they got out of the church in Birmingham that was firebombed, they all had tears. And after that, they had a meeting in a circle, and they vowed to have a truce when they got back home, between the Bloods and the Crips when they got back home to Fort Worth. So it was quite moving, but it was also a brilliant way of helping young people find their own identity, their own history, something they can be absolutely proud of, and then build on those strengths of identity and resilience and fighting. So it was just really a remarkable event.
We'll talk a little bit more about, how YAP has expanded over the years and changed and all those things. But let's get back to like the core of it. For folks who don't know, this began for sure as an alternative to incarceration. What would you say are the just absolute, from 1970 till now, core to the soul of YAP model characteristics? Like, what has to be part of like any YAP site, any YAP operation? What's crucial to the middle of this thing?
Yeah. We're Council on Accreditation, and when the teams come in, they actually visit our sites around the country to evaluate us and see if we get recertified. And they always come back and say, we visit all your offices. We come away with the same flavor, the same ethos from every one of your programs. And what that is, the core of the model that has to be there with any youth program, I think, working with very tough kids with a lot of needs, is relationship. You have to have one person who owns that relationship, who says, I will be your mentor, your advocate, your person who's going to follow you through and accompany you through what you're going through now. The other ingredient, you got to recruit people from the neighborhood where those kids live. We call it zip code recruitment. That was coined by Carrie Cockrell in Fort Worth. All the people we hired came from certain zip codes in the community. They know the strengths of the community. They know the resources. They know the weaknesses. They know where to go, where not to go, when and how to carry yourself. They speak the language. And it's so essential, that local knowledge and those people that have been there, done that, now giving back to their own communities and developing these meaningful relationships with kids. You have to have time. When I was coming up, everyone had caseloads. That was a thing in the 70s and the 80s. I have a 50-kid caseload. I don't have time to do what's really need to be done. And what Tom did, he created this system that said, you got to give these kids at least 10 hours a week or 15 hours a week or 30 hours a week. And you develop that contract. So these kids got the time they needed. They weren't low man or woman on the totem pole, because they're difficult. The case manager would only, provide a half hour a week or not even find them some weeks. We had to hire people that can go out and find these kids, engage them. So it's relationship, it's youth engagement, it's time with the kids and families, it's recruiting staff from the neighborhoods. And then it's treating the kids with respect and also addressing all of their needs, not just their offending behavior, if you will. What's happening at home? We have to engage the family. So these are the ingredients: relationship, family, neighborhood-based recruitment of staff, time, sufficient time with the kids and families. And that's universal, I think, not just YAP, but any program that works really has to have those kind of ingredients.
So that's on the organizational level. you've presided over this thing for many years now. And like you're saying, it really comes down to the relationship between two people, the youth and their professional, trained by YAP mentor in their life. So after doing this for decades, I want to talk about your view of the person now. What do you see as the defining characteristics of a good youth worker in the space? What are the must-have qualities in a person that's going to do this stuff? Other than what you already said, which is you put a premium on, they've sort of walked literally the same roads to some extent as the youth work.
No, good question, John. And of course we have advocates from all walks of life, people, college interns, to people in their 80s still giving back to their community, people with PhDs and master's degrees, and people with a GED or not, I didn't graduate high school, all ethnic groups. So it is a wide variety. But essentially is the question that I ask the directors of programs when they're recruiting staff, I say, ask these questions when you're interviewing to yourself. Would I allow this person to work with my own children? And if you would, then you'll let them work with other people's peers. Yeah. With the referring authority, with the chief of probation or chief of child welfare, be happy that you hired this person after they met him. So now people that fund us to do this work are saying, yeah, that's the kind of person that I think would do great here. If you were a kid yourself, would you want this person coming into your home and chasing you through the alleyways and, demanding that you meet with them, and this person following you into school or helping you find a job? If you were a kid, would you want to relate to this person? If you can answer all three of those questions in the affirmative, then that's the kind of person you want. Now, what are some of the characteristics? I was told by kids, I've worked direct practice for many years, and the feedback I got from kids was, you never yelled at me. You never put me down. Even when I was really messing up and being a real jerk, you didn't judge me. You didn't put me down. And even after I didn't deserve for you to come to see me anymore because I was doing such crazy things, you were there the next day. So it's that never give up approach. It's a style of relating to people that's non-confrontational, non-judgmental, non-blaming, big sense of humor, knowledge of resources in the community, a real confidence that you know this community and you can help integrate this kid into the positive parts of the community. Empathy has got to be there. But I'll end with this one thing because I read it in a textbook many, many years ago, about 50 years ago. And it was a practitioner who said, the research, what works best for the really tough kids? And she said it wasn't the degree that you had. It wasn't the training that the worker had. It wasn't the model that you used. It wasn't the pay of the worker. It was the optimism of the worker. If a worker was optimistic that they can help that young person, then that's, lo and behold, that's what happens. It's that optimism, that never give up approach, unconditional caring, as Dick Sammons called it back in the day. And that's the last trait. They have to be optimistic, can-do people who really think you can really help this young person in some way.
So you guys actually had like a major independent evaluation of YAP around, 2016, 17, that really got into this stuff, right? Like studied the nature of the work and what did or didn't show promise and all that stuff. I don't want to get into a 20-minute discussion on an evaluation, but I'm just curious as a leader, what did that study affirm for you about what you guys were doing, and what, if anything, did you change? What change did it prompt, and how you thought about, organizationally and training and all that?
Yeah, one of the things that the study, it was University of Texas, San Antonio that did the study.
I mean, the results were good. Spoiler. I mean, it said that YAP was doing effective work in this space. So that on the
yes, and in fact, it got us an OJJDP, Office of Juvenile Justice Delinquency Prevention, evidence-based status, actually, as well. Right. So all that kind of stuff that I always fought against, but we got it. But yeah, one of the interesting things there, advocates who had been in some kind of a teaching position, even if it was Sunday school, it didn't have to be a formal education. They had a lot of success with the kids. And I think that talked to their ability to conduct activities with the young people and to set boundaries and to, provide real content for the kids, not just to hang out, that there was real purposeful, meaningful activity with the young people that worked towards their goals. And of course, every one of our kids had to have an individualized service plan that was a plan that hopefully gave us a shot at getting this kid off the snide and getting things moving in the right direction.
Yeah.
And so people who had sort of the ability to work with small groups of kids and bring content to the relationship and always kept purposeful, meaningful activity at the forefront had the most success. Of course, in our interviewing process, started working with people who had that capacity, whether they're actual teachers or not. And so that was an important note for us.
Yeah. Yeah. The thing that stuck with me when I was reporting on it was it really, as an outsider who is not a youth worker, have not done this type of thing, really kind of turned my assumption on its head. Was I think I would have assumed, the way to kind of get yourself in with a youth so that they listen to you is to be a good hang early. Like, let's go watch the Sixers play if we're in Philly, or let's do fun stuff, and then kind of build that and build off of that with serious stuff. And it seemed like their assessment was like the workers who establish kind of a firm, like what you were saying, they run through the alleys, they demand that the youth engage, and then get more into play later. That was kind of the sort of best path, or the most
absolute
path.
Absolutely. Strength-based approach. We go out of our way to identify what are these kids good at, what's their talent, their asset, their capabilities, their hobbies, their passions, their dreams, and then use that to really create the activity. So if they're into music, maybe the first purchase we do is one of those computers that you can record videos and music. If it's an instrument, let's get that guitar into the house. If it's art, let's take them to an art program. If it's sports, let's go to the Garden. Let's go to see the Dallas Mavericks play, or the Knicks, or whoever. Absolutely. And then through that, you gain trust, right? Because the beginnings of any relationship are about exploration, power and control issues, right? So you want to design programs and activities with the kids that they like, they enjoy, it appeals to their interests and strengths. But it's also something where you can begin to explore what this relationship is all about and begin to make plans together.
Yeah. So I think I still instinctively, when I think about YAP, what it conjures to me is an alternative to a youth being incarcerated. As in, yes. But for YAP having this program in this place, the system in said county or whatever would have locked this youth up or detained them or anything. But I think, is it safe to say at this point that YAP is now more used as a prevention strategy than an intervention? I mean, is it more of the business and more demand that you guys see for your efforts centered on sort of identifying kids that are likely to get locked up or have committed a lesser offense, and they're just trying to get ahead of it?
That's what the systems try to do sometimes. Yeah. They drift, the mission drift. But I'm pretty happy with the many years of my tenure with YAP, and my team are very happy. We really stuck to mission. In fact, I think many of our programs, our larger, well-funded programs, were totally on mission. They were absolutely, as you just mentioned, John, if not for this intervention, they're going away. They're going to a youth or an adult prison. They're going to a faraway residential treatment center for child welfare. They're going to a group home, etc. And so I think one of the accomplishments in our later years, we were able to convince referring authorities and funders to put more resources, to pay our staff better, to put more flexible funds in the contract, to put supported work, which is subsidized employment, in the contracts, more time with kids and families in the contracts, and fund that. And therefore, we're able to work with a kid with the most complex needs, the kid that is definitely going away if something dramatic is not going to happen. So I think in the converse, we didn't become, and I think it's a credit to the team, we didn't want to, and we did not become a softer kid program, a cherry picker, just choosing the kids that you can succeed with the most. We said, no, we want the kid that no one has succeeded with yet, that this kid in this particular system they're in, county, city, state system, the only options for them are out-of-home placement or a cage. Those are the kids we want. Those are the kids we want a shot at. Make sure we're well-resourced, and we'll be successful with 80% of those kids.
I don't know. Well, I mean, I guess I wouldn't have seen that as drift for you. I think there's a difference, let's put it this way, between drift as in, oh no, we're not getting contracts to do what we want, so we got to go chase the others, as opposed to we think what we're doing with this group can work in other instances and go. And I guess the reason I asked you is because, I remember just kind of talking to some of your New York folks, and I think it was like eye-opening to me. I was like, wow, a lot of their work now is contractually with like a child welfare agency, right? Mm-hmm. To do kind of prevention work or to serve, I guess, youth in foster care already, which I guess I wouldn't see that as drift. You know what I mean? Like, I think that's just adapting to a different set.
Right, exactly. I understand. Child welfare has always been part of our mix. The days when Tom was beginning the program, we always had child welfare contracts. And as opposed to getting kids referred to us that were one step away from a cage or a prison or detention center, they were one step away from a residential treatment facility far from home or a group home with a high recidivism rate, where there was a lot of abuse, and et cetera. So child welfare, it's an alternative to out-of-home placements. It's sort of the catch-all. So we also don't see that as drift. We see that as definitely something that's needed in today's systems change work. Child welfare now is getting, thanks to you and Imprint, is getting much more spotlight, the child welfare system, than I think in many, many, many years. So yes, alternatives to out-of-home placement would be our mission.
Okay. Yeah, I see that. I had a chance to sit down with Tom about, I would say, a year before he passed away, just for kind of a last interview, right? And, two things that stuck with me about, how he saw the field of youth work evolving at the time. One was that he felt like, I think he was wary of the like outsized presence of like behavioral health contracts and like managed care and Medicaid. Like, I think he kind of felt like that was taking over, and it was going to, I feel like he was worried that was going to make it really hard for you and to kind of stick to what you were doing. And then the other thing is, I know that you're passionate about this, is really came through to me, was how important the supportive work piece was to him. Like, this doesn't work if you're not getting youth, acclimated to the earning money, the work ethic and stuff like that. So I guess to start with that, like that managed care concern, I mean, do you think he was right? Is that a real challenge? Obviously, you guys have made whatever comes your way work in terms of operating your programs. But I mean, was he right that would become a sticky aspect of contracting to serve kids?
Yeah, he was a visionary in many ways. Absolutely. And I shared that concern with Tom. We do have behavioral health programs at YAP, and we try to gear those. They're Medicaid funded. So those activities that you talk about, John, you go fishing first, go to the ball game first, and then you do the intervention. Yeah. You don't get paid for that. Right. When you do a behavioral health program, they don't pay you to go fishing with a kid. They only pay for a clinical counseling session.
Right. So that was the word. That's the word. It's YAP is not clinical. On just right, like it's an intervention, but it's not a therapy in and of itself.
Yeah, it could be part of the individualized service plan. And many kids do need clinical work services because of their trauma, because of an organic or biological disability that they may have, because of genetic stuff. And they do need a good clinician. So that could be part of the plan. But all too often, human service systems, that's all they do is the clinical work, because that's what you get paid to do. And we look at housing, we look at education, we look at their legal, we look at social emotional, we look at cultural, recreational, employment, etc. You've got to look at the whole kid.
Yeah.
And unfortunately, especially the child welfare system and the mental health systems, they only fund, clinical work, where you can convince juvenile justice systems to pay for more, to pay for the whole thing, all the things that a kid might need. So, so I think he was right to be cautious, but I think we still behavioral health and those kinds of contracts are not mostly what we do. It's a nice adjunct because kids do need clinical work. But I think most of our kids are from child welfare, juvenile justice systems, and it's not Medicaid dependent. I mean, there's one case where a state commissioner nixed one of our programs because we weren't drawing down Medicaid, and didn't care what kind of results we were getting with the population we worked with, or the staff we had. The fact she couldn't get paid from the federal government for this particular service, she nixed it and brought in a program that could draw down Medicaid. So that does happen. There is a trend towards that, but I think we've been fighting that off, and the field has been fighting that off pretty well.
How about with supportive work? I mean, do you feel like you're always having to sell, places on paying for that, or do they get it instinctively, or what?
Yeah, for many years, it was very hard to fund supported work. And it still is. I mean, you pay for your worker, you pay for your transportation, your activities, and then you're adding on subsidized salary for a kid, wage for a kid.
Just to clarify, people have not heard that term before. It's basically like, correct me if I'm wrong, but you guys, a component of your budget will go to like enhancing a salary you find employers who will hire a youth and maybe pay them more, or you help subsidize them to pay the youth.
Yeah, we try to go to a private small business, a local barbershop, a carpenter, a plumber, electrician, a lawyer's office. In Fort Worth, a rodeo, a barn, a cattle ranch, horse farm, an airport, etc., and a small airport. And we'll go to a local private business owner and say, would you take this kid on as an apprentice, show him the ropes, show her the ropes of this, what this is about. She's interested in upholstery. She's interested in art. She's interested in plumbing. We'll pay the salary or part of the salary, depending on what agreement we have. We'll take care of everything else. You just show patience and support and see, and hopefully you'll want to hire this person after 3 months or 4 months. And if not, we're building that kid's resume. So then they go on to the next site and the next site. And that's just wonderful, because you can do that the next day. We can get a kid in a program, and a director who's already recruited businesses for this project might have 15, 20 businesses ready to take on kids through supported work. And you can meet a kid one day where this kid desperately needs money in his pocket, cash. And that's why they're dealing and wheeling. And you can literally walk in tomorrow, bring him to the carpenter shop and say, meet your new employer. And then hopefully that works out. If it doesn't, we'll go to the next and the next site and the next site. So it's a powerful intervention. Money in the pocket, training, acceptance, belonging, the way of the world, social capital. And that's, the kids are seeing it all in that experience.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code podcast10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code podcast10 today.
Obviously, as we've been talking about, youth have had tremendous success expanding and scaling YAP up over a long period of time. I think you're in 33 states now and DC, and you got some international stuff going on, right? Ireland, Guatemala, yes. What else?
Australia, Sierra Leone. And we were in Sweden at one time, in the UK at one time, for a few years each. It was really cool because it showed that you can take this model, that's very simple, it's not rocket science, and you can transport it in different cultures, different countries, and in very exotic places. Yeah, and that first started, I was fortunate. I went with Peace Brigades International and the Fellowship of Reconciliation back in the early 90s on a delegation to Guatemala. We met with 18 underground civil groups that were fighting for human rights in Guatemala during the civil war there. And it was just amazing people that I met. But one of the people that I met was folks that work with street children. And what we learned is that not only were the street children being murdered in the streets of Guatemala by businesses and government hit squads because they were nuisances, but the youth workers that were reaching out were being killed, were being imprisoned, being tortured. And I said, wow, we work hard here in the States as youth workers, as street workers, as outreach workers, but our lives are not necessarily in danger like that. Yeah. We're not being imprisoned. We're not being threatened. Our families, we're not being murdered. So we decided to do a form of accompaniment, the Gandhian concept of accompaniment that Peace Brigades International uses. And we started sending down delegations to a street work program in Guatemala. And we started doing fundraising. So we had all of our staff, and now we have 2,000 staff at YAP, and they would each donate $1 a week to our foreign programs to really show solidarity with fellow youth workers, fellow social workers, fellow street workers, and the work they were doing in very, very dangerous situations. So then we did that in Sierra Leone, and a building is named after Tom Jeffers. A school that they started there was named after Tom in Sierra Leone, Freetown. And then we went on to Australia and helped a local nonprofit bring Aboriginal youth out of at-home placements back home. In the UK, we helped them develop a alternative to incarceration program. And in Ireland, which is still going, YAP Ireland is still going after 20 years. They just celebrated 20th anniversary. And YAP Ireland is in all 20 counties as an alternative to their larger institutions.
So fully scaled. Ireland is fully YAP scaled.
Yeah. Yeah. It's kind of neat to see the vernacular using YAP in the Irish vernacular, So very cool.
Has anybody ever approached you? I was thinking about this because of what you were talking about with Guatemala, because I think there's quite a direct line between what you just described and why we see thousands and thousands of youth arrive from Guatemala and seek asylum here, right? Mm-hmm. Which has become this huge controversial program. Have the feds ever contacted you guys to try something out with the YAP model and unaccompanied children when they get here?
No, we wrote a proposal actually a few years back.
It's all shelter based, and that's kind of what they fund.
Yeah, remember the Walmart that they converted into a big shelter for hundreds of kids, et cetera. That's where they were putting their money in. And, I was the chair, and I'm still on the board of the National Human Service Assembly, and which is made up of large nonprofits, human service agencies throughout the country. And we were thinking there, my God, what if every nonprofit human service organization took in 5 kids, and helped them resettle? How doable is that? You don't need to put them in an abandoned Walmart, or you can use, the models that we all think work. And these are kids that are ready to work, that are ready to, settle and do well. And they just need that the social capital. They need that connection. They need the guidance. So how doable is that? But
I think it's doable within the current context when we have the capacity to not have those things like the Walmart happen. But I mean, before this program became it's crazy how much it's exploded. It was like, I was just looking at these numbers, but I think we had something like 13,000 kids arrive at the border in 2012. It's like 130,000 now. We used to have the places that would provide shelter while they found places for these kids to live were like, a residential program, maybe a group home and stuff. And now we're operating these huge, massive things. So it makes it look, but it seems like the ones that end up and, obviously once they get to a sponsor's house, they're a great candidate to be in a mentoring relationship with somebody here. And even like I'm thinking like Children's Village or some organization that does a pretty good job of sheltering kids and caring for them, in that way. But anyway, that was a huge departure. The original thing I was going to bring up was you guys have gone from this one program in Harrisburg in Pennsylvania all the way to 33 states and all these countries, and genuinely mystifying that nobody has followed you unless you disagree with that premise. So I guess my question to you is, why do we still have this enormous dearth of alternatives to incarceration? I was kind of most recently thinking of this. I was kind of leafing through the Sentencing Project's recent policy paper, which was pretty, I was like kind of shocked that they just kind of hit you with the outset with like the view that, incarceration of youth has plummeted in this country. And it's largely because just youth get arrested less. It's not really anything we're doing. And in the meantime, we so badly need these alternatives to incarceration, or we'll probably at some point see a snapback. And then they gave some examples of programs, and it was like you guys and cognitive behavioral therapy and a couple little mom and pop programs, which I'm sure are amazing. But like you could have run that list in 1995 or 2005 or 2015. Nothing seems to have changed. Why do you think nobody has said, oh, YAP did this, we could do it with our model, or I want to build the next YAP?
That's a great question, John. And I think we knew exactly the answer. We'd be able to move things further. But, well, first of all, like you said, 2,000, over 100,000 kids incarcerated. Today, less than 40,000. I'm not sure the exact number now. So it's over 60% reduction in 20 years, and a lot If you go back to 1990s, it's even greater.
Yeah.
Reduction in number of kids in cages.
And much less in the huge places too. That's the big change.
Exactly. Yeah.
Big prisons.
So great progress. But you're right. When you look at where are these kids going? If they're not going to institutions, where are they going? And that's still the question. Why don't more people do this? Two reasons, I think. One is in the systems way, there's still a bias towards taking kids out of the home and putting them away somewhere. And, I know $5 billion that our country spends on just detention or something. So there's still that mentality of we need another detention center. Pennsylvania did that whole reform thing. The assessment was incredible. Most of the kids in Pennsylvania prisons are there for nonviolent crimes, and many for just violations of probation. So the Pennsylvania jails are filled with kids not committing serious crimes. Yet the probation chiefs throughout Pennsylvania are fighting for more detention beds. So there's still this bias that you need for convenience or whatever it is, you need these detention centers. So as a system, they're still pouring money into edifices, in buildings, et cetera. Now, on the nonprofit side, why aren't more people out there saying, I will take that kid, don't put him in that cage, I will take that young person and work with their family? It's hard work. It's high liability. It's high risk. And if you don't know what you're doing, if you don't have experience in that area with a really tough young person and family that's resistant to services, not amenable to therapy, et cetera, it's scary, and you're not going to get a lot of money for it, So on both sides, the risk, the liability, the danger, the complications, you have to gear your whole organizations to working with these kids. You can't just have a program on the side that says, I'm going to do all this behavioral health work and this mentoring stuff, and then here I'm going to have a tough kid program, because that's never going to get the resources it needs there. So it's just very, very difficult. It can be done, and I think that's what I'd like to do with my next stage of my career, the next chapter, is rather than saying, let's bring YAP into this community, let's help you develop this grassroots in your own community. Let's really move and put together. John, you did a brilliant piece a few years ago where you looked at all the viable alternatives to incarceration across the country. And each one of your issues, you highlighted another effective alternative. But not all of them didn't exist in one community. There was one program here, there was one program there. What if you put all the programs that you highlighted together as part of a continuum of care in one community? No kid would ever have to be locked up, And if you did for a short period of time, there's a brilliant aftercare program to reduce recidivism. So we really need to invest, from the top, and then the grassroots nonprofits need to advocate for true network of services for the kids with the highest need, the highest risk, the most complex needs. And you can really do that. It exists in our community. But let's integrate it so that each community has the array of services that you highlighted. And I think that, that just would go a long way. But that's not the mentality right now. It's, one-off programs here. I'm happy that I got my detention, census down by 10%. But it's still the same way of thinking. To work with kids that commit crimes, you've got to have a building for them, and you have to put them out of community for a while.
You're going to hate this as a follow-up question, but I always feel like the best people to get perspective from about the use of incarceration, about the use of detention, are the ones who don't want to talk about it. As somebody whose whole career has been hell-bent on keeping kids out of that deeper end, what is your view of the situations or the factors in a kid's life where they do need to be secured in a facility?
Yeah, great question. And again, I think it talks to the continuum. We don't know how many kids that is that really going to need that secure setting when we don't have the normal supports kids need throughout a community. So the question of how many kids really need to be in a secure setting is never going to be an honest answer unless we do have a full continuum to take care of those in Pennsylvania, all those nonviolent kids in prison right now.
Yeah, I'm less interested in how many as what are the things that would make you feel, okay, it's not safe for this youth.
I have advocated for kids to be put in a detention center in my career. especially my direct practice work and when I was doing street work. I would see a kid, and this kid in this moment now is a danger to self and a danger to others. And I can see that, I can evaluate that, assess it, and it's real. And the other kids around me that see that, yeah, that kid's crazy. That kid needs to be, helped right now. There are kids like that in moments. And usually what those young people need is a temporary, sometimes for just a few days, a safe place, maybe with doctors, maybe with therapists, maybe with just caring people around them until they settle down. Maybe they do need a med for a period of time, a good psyche value. Because most of these kids that I would say are danger to self, danger to others, they're severely addicted to some drug, or they do have a really profound mental disability or an emotional diagnosis, if you will, that's really serious and it's real. It's organic and you can see it. And those kids need a safe place for a few days until they stabilize. The real question is when they come out after 4, 5, 6, 7 days, what's the aftercare plan? Mm-hmm. What's the nurturing and the support and the continued treatment that they're going to get? The monitoring, the hands-on. And to me, that's the real question. So I think we can create group home type settings, maybe even a few beds in a hospital that is well staffed and redesigned, where kids can go for those moments when they are danger to self and danger to others. But you don't need $5 billion worth of cells in this country to do that, not in any stretch of the imagination. So, yes, I've advocated, and, I worked with a kid in Jersey City who was being trafficked. She was 14 years old and being tossed around with pimps and whatnot. And I got into a car chase and I did detective work and then finally contacted the Jersey City police and they helped me to find this girl in a hotel. So we found her. She was being raped in this hotel and police went in, got her out and said, okay, Jeff, what are we going to do with her now? And there was no facility to put her, to get her medically checked, to keep her safe because she wanted to go back to the streets. She was so drugged out. She was still a danger to self. And the only place we had was a detention center. So we had to call up a judge. This was in the 80s, and we had to make sure that he knew of this situation and that they were going to look out for this kid and then get her into a hospital after that. And then finally, into a plan that really kept her safe. So yes, our continuums just don't have places for kids that are danger to self, danger to others in those moments that they need us the most as adults. And if we create more of those, and then much less of the cells and the bars and the beds, we'll be much more effective and have a much more robust continuum because we'll have the money to do it. By divesting in detention, youth prison, and residential, and investing in community partnerships and programs and supports, formal and informal, communities can be very, very, very strong.
The leadership of the organization YAP, I would say you guys must stand, if not alone in history, you've got to be one of the most stable organizations as defined by the executive position that I can think of in the work of youth and family services. You've had a founder who handed off to you, a guy who had worked there for more than a decade, who then stayed for 20 years almost, and then handed it off to a guy that's been there for decades. That's just so rare. Was it somewhat luck that you guys had that kind of continuity, or were there things along the way that you felt made that happen? And, what was your personal secret to staying in a CEO position for that long in this work? Mm-hmm.
For me, it was the mission. That first conversation I had with Tom Jeffers, reinforced by Paul DeMuro and Bill Ryan and Dick Sammons and John Vandenberg and Carl Dennis, the wraparound group, great thinkers and doers.
And I'd be able to interject quickly. Paul DeMuro is kind of a good, I don't know, counterfactual is not the word, but like a guy who never worked for anybody, right? He just left to work you worked for the same place forever. He just kind of did his thing with all these. This is the late Paul DeMuro. I'll put our story on him in the show notes of this podcast.
Yeah, the short story is that I couldn't do what I did without their model of how to be in this world in this industry, and their encouragement and their thinking. It's almost what would Tom do? What would Paul do? What would Jerry do? Right. So, wanting to affirmatively carry on their legacy and what they started back in the 60s was at the forefront of my motivation. But with YAP, I also personally got to do so many things. I mean, like you said, we went international, which was just a wonderful assignment and experience. We got to go to 33 other states. We got to get into other types of programming, education and workforce development, etc. Got to meet so many amazing people. But most of all, working with staff. When people say, what's the success of YAP? What do you attribute it to? It's the people we work with, that I work with, my team, and the teams that I was part of. Just brilliant people, and so dedicated and committed and creative and joyful to work with. So I think those are things that kept me there for 20 years, and then seeing the progress. But the secret, is we're all dedicated to mission. Gary, he was chosen because of his 30 years there, and he's still a young man, and he was into the mission as much as me or anybody else in the organization, and proven and had helped build it. So now he, to help go on and move on further. So I don't know, it's building, it's camaraderie, it's a group of people that believe in the same stuff. It's a history, a legacy that goes back decades. So it's all put together in the mix, and what you got is what YAP is today. Working with 20,000 young people and their families over 33 states and a few foreign countries, and leaving its mark in this period of time.
Over psychoanalyze you too much, but I wonder how much, like you really, truly, we kind of kidded about it at the beginning. I mean, you love sailing. It's a thing. It's a huge part of your life. I guess my point was there's got to be 5 times in a 20-year career where you're like, I really can't do this anymore. I gotta get out of this. Too much pressure. This is hard. Having something else probably means a lot, right?
Yeah. Life balance is great. Family and I didn't say I'm tired of this or that I can't do it anymore, but I certainly said I need to pass this on to someone who's going to still young enough and energetic enough to carry this on. I didn't want to leave the field. I still want to, like I said, do some consulting and do some work to help communities really develop their own solutions. And I am developing a new nonprofit in order to do that.
Oh, breaking news. Do you have a name yet?
Neighborhood Safety Solutions.
Neighborhood Safety Solutions. You heard it here first. All right.
Yeah. So, not the perfect name, but it really talks about the same thing we've been talking about for this past hour, but helping local groups, local grassroots nonprofits, and hopefully the board of directors will be 90% people with lived experience, people who are young people in the systems and can really talk to what needs to be done with an organization like this. So that's what I like to spend my next few years, I think, doing. But sailing, is a love, and I just acquired this new old boat that I sailed down from New Bedford, Massachusetts, and I can't wait to spring so I can get back on it again and maybe even use that as my office or something like that, and sail up and down the East Coast doing this kind of work.
That would be amazing if you just, all your meetings with communities, you just I'll sail there. I'll see you in 3 weeks.
Right. See you in Savannah, Georgia, and Richmond, Virginia.
Amazing. All right, Jeff Fleischer, former CEO of YAP, now founder of Neighborhood Safety Solutions. Breaking news. Thank you for joining us on the Imprint Weekly Podcast.
John, again, thank you for all you've done for the field. You really put a spotlight on our work and on the issues like nobody else has. So I'm really honored to be talking with you.
Thanks to Jeff Fleischer, former CEO of YAP and new founder of Neighborhood Safety Advocates, for joining us today. The Imprint Weekly Podcast is a production of Fostering Media Connections, a California-based nonprofit that publishes the Imprint, Fostering Families Today, and operates the Youth Voices Rising program. This podcast is produced and mixed by Christine Anjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we'd love it if you consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.